Hi, welcome to Decoding Indigenous Health. My name is Ruthie. We will be breaking down the health disparities affecting the MLGBTQIA2S+ community, specifically the high HIV and STI rates. Throughout this video series, when discussing health disparities for the MLGBTQIA2S+ community, we'll use the psychological nexus of HIV risk model from Andrew Jolivet's book, Indian Blood, HIV and Colonial Trauma in San Francisco's Two-Spirit Community. In future videos, we will use this model to analyze how colonial structures of violence affect health disparities and healthcare access for each group. Here are some definitions for some terms we will be discussing throughout this series. The National LGBT Health Education Center defines sexual orientation as how a person characterizes their sexual and emotional attraction to others or one's behavior, attraction, and identity. Identity does not always align with behavior and can change throughout a person's sexual journey. The National LGBT Health Education Center defines gender identity as one's internal sense of being a man, a woman, both, neither, or another gender. If your gender aligns with what you were assigned at birth, you are cisgender. But if your gender does not align, then you may identify as a transgender person or a non-binary person, depending on what you feel more comfortable with. HIV.gov defines HIV, which is the human immunodeficiency virus, as a virus that attacks cells which helps the body fight infection, causing the person to be more vulnerable to infection and disease. HIV spreads through contact with blood, semen, and pre-seminal fluids, rectal fluids, vaginal fluids, and breast milk. It is most often contracted through unprotected sex or sharing injection drug equipment. Two-spirit is a term specific to Indigenous folks to reclaim and erase identity of folks who are outside the male-female gender binary and who held a special role in their society, such as healers or carriers of ancestral knowledge. This term was created to replace oppressive colonial terminology in 1990 at the 3rd Annual Native American First Nations Gay and Lesbian Conference. Thank you for watching, and make sure to check out our other videos on trans, mixed race, and Indigenous health disparities.